We're very fortunate that we have been named as one of the 9 Ebola and special pathogens treatment centers by the federal government. What this means is that we have been recognized for having the space, the plans, the training, and the facilities available to care for someone with some of the most infectious diseases around. It's really a great honor to be named as one of these centers. It's recognition of all the incredible hard work that so many people around this institution have done. It does come with a burden. It obviously means that we have to be ready to accept patients who have very serious types of illnesses, and it's a burden we take very seriously. We have a great community of experts with infectious disease, infection control, security, emergency medicine, emergency preparedness, lots and lots of people around the hospital to make sure that we can do this safely.
What we were challenged to do was devise a unit that could care for patients with Ebola safely, but also during the rest of the year, the 365 days of the year, care for patients that we normally care for and need this type of care. So what we decided to do was modify the existing room structure and some of the functionality to make it so that we could take care of these patients safely, both for the patient and for staff. We needed floors and ceilings that are easily washable and cleanable. And so the adjustments we made were to have a monolithic ceiling, the floor that has very few seams, it has the cove that goes up. So there's a set of 3 rooms, and there are 2 patient rooms, and in the middle room is where we doff, or where care providers who are coming out of each room will safely and under the supervision and with a coach remove all the gear that they have on in a safe way. And then going to the next room is this sliding door, so really touchless in terms of getting into the doffing room. So if you can imagine a patient here, there's nurses and doctors, and they've decided that it's the time for them to leave the room. They'll signal to a colleague who's in that room, and that colleague's going to say, I'm ready to doff you, I'm ready to help you take off your gear. This is not a room where we would actually care for an Ebola patient. It's really almost like a utility room. It's the doffing room. It's where we prepare specimens. It's where all that equipment that the providers are wearing, the PAPR motors, get cleaned and removed from the rooms. In the event that we were activated, even with a single patient, this entire part is cordoned off, and the way we do that is we have a prefabricated wall that goes up right outside this door. It includes these 3 patient care rooms, as well as a nursing station and an office, as well as a conference room. And so that allows us, even if we didn't have 2 patients, to really be able to separate the care here, to separate all the workings that go into taking care of such a patient.
So we've allowed space modifications to make sure that we can handle the air, modify all of the variables around those patients to make sure that we can take care of them safely. And then again, make sure that we have good training programs in place and exercise those programs frequently so that our nurses, our laboratory staff, anyone who's involved in the care of the patient feel very, very comfortable in their use of personal protective equipment, the gowns, the hoods, the respirators, all of the equipment that they need if we get a patient like that. It's important to notice that we are part of a very special group of facilities, and already just being part of this grant program, we've started to share a lot of resources. We share plans, we share protocols, we try and come up with solutions together, we're conducting research together. Having this group of colleagues around the country means that we're not just solving these problems only by ourselves, we're doing it with a group of experts and people who are really dedicated to providing safe and effective care for people with the most dangerous infectious diseases.